Hi, this is Dr. Nanabati. I'm going to talk to you today about left atrial appendage and atrial fibrillation. Did you know that atrial fibrillation can cause a stroke? There's a clinical criteria called CHADS-VASc Score, and if the CHADS-VASc score is anything greater than 2, there is a propensity and a risk for stroke. The higher the CHADS-VASc score, the more the risk of stroke. What is the cause of the stroke? It's basically a clot in a small structure of the heart called the left atrial appendage. The appendage is part of the left atrium. It's a little outpouching that basically has no real purpose, but it's a vestigial structure, and because it's an outpouching and in that left atrial appendage, the blood flow is stagnant usually. And if it is stagnant to some degree, then it can cause thrombus to form or clot to form. And if that clot then dislodges and goes up into the brain, it causes a stroke. So this is why atrial fibrillation has a high propensity to cause a stroke. So what do we do about it? Because the clot in the left atrial appendage is usually the cause of stroke, we use anticoagulation. Anticoagulation basically reduces the clot and does not allow clot to form. However, anticoagulation or blood thinning has in itself risks because you can bleed from other areas and you could also bleed in your head. So blood thinning itself is a risk. So what happens to people who've had blood, like bleeding problems, like GI bleeds or blood in their stool or other places where they've bled in their brain? What then can you do if they have atrial fibrillation? That conundrum has been solved by a device called Left Atrial Appendage Occluding device. That device is used to essentially plug the left atrial appendage, and therefore the appendage is therefore excluded from any involvement with the blood circulation, and therefore even if there's a clot in the left atrial appendage, it will not be dislodged and go up into the brain. So when people cannot tolerate blood thinners, there are devices called left atrial appendage closure devices. And what are those devices? Well, there's several different devices, and in Europe there's even more devices available. In the United States, the two devices that are available are the Boston Scientific Watchman device and the Abbott Amulet device. Both of these devices are available to close the left atrial appendage and therefore prevent stroke.